Ebola deaths are being recorded in more and more countries around the world. A United Nations worker has now died in hospital in Germany, the latest victim of the virus outside Africa. At the heart of the pandemic in West Africa, the outbreak has now killed almost 4,000 people. Thousands of others remain infected. Ebola's got medical agencies, of course, on high alert, but the infection rate is still way below, incidentally, other viruses which prove fatal. Flu is so easily transmitted. That accounts for over 250,000 lives lost every year, while pneumonia kills even more. It claims about 4 million a year. So the question is, and I guess at the moment, why is the world community so fired up, so concerned with the Ebola threat when other diseases are proving, at the moment anyway, far more widely fatal? Well, let's get some thoughts on that from Winifred Romero from the World Health Organization. Hi there, Winifred. No matter how you look at it, Ebola is scary. I can see that. I don't know if you're just managing to listen to what I've said there, but we just saw the comparative numbers for killer, contagious viruses. So why is Ebola making all the headlines right now, particularly?
Well, you know, Ebola is scary because it's so lethal. You don't infect many people when one person gets ill. They maybe infect 2 people. But right now, you know, maybe half of those people or higher might die. So I think that that's reason for concern because it is so virulent.
Well, so it is definitely a bigger problem, let's say, than pandemics of flu, et cetera, et cetera. This is a real killer and a real menace, yeah?
It is. I mean, certainly you would find people in the countries that have been affected saying that. You know, it really gets to the heart of a culture like we see in some of these West African nations where people are very affectionate, they hug a lot, they care for people around them. And you can get Ebola from people who are infected by being in contact with them if they're highly infectious. So when people are sick, you know, people take care of each other when you're sick. And that's the time when people are most infectious, is when they're already quite ill.
I mean, Ebola's not new. It's flared up before, hasn't it? But this is by far the worst outbreak, is it? And why hasn't more been done? We're hearing even weeks ago, more should be done, more should be done. Is enough being done already? So, why wasn't this diagnosed earlier, and is enough being done now?
Well, it wasn't diagnosed as soon as other outbreaks, mostly because it mimics a lot of other diseases. Ebola's never been seen in this area of Africa before. So in West Africa, they've never dealt with Ebola. So when it broke out, it was actually in the middle of, you know, a time when other diseases were on the upswing: malaria, cholera, other diseases that look like this. So they would test someone for cholera, for example, or for malaria. That test would come back positive, and they thought, oh, you know, this person is so sick because it's this disease that we've confirmed they have.
Why is it flared up worse this time?
Say again?
Why is this outbreak flared up more than others in the past?
Well, first of all, as I'm explaining, it got a head start on us. Often when Ebola shows, we find it right away. It's in communities where they've seen it before, they suspect it immediately, and you're able to contain it very quickly. Like we've seen the case of Senegal and the case of Nigeria, they were able to contain the cases that they had very quickly. But this got a 3-month head start on the international community before we realized it was Ebola. So you have, for example, the case of one traditional healer. When that healer died, there was a massive funeral gathering, and we can trace back over 350 deaths to that simple funeral, that one funeral where people were in contact with the body. And so that's why it got ahead, because there were so many chains of transmission that escaped. And then once it got to the big cities, I mean, that we haven't dealt with that before. And
well, I was going to come on to that. Can it be contained? And we're seeing all the headlines everywhere now. Are these headlines being overblown? I mean, what's the worst case scenario? We know what the worst case scenario possibly could be. It's almost unthinkable. But where do you think it's going to go? And are the headlines we're seeing at the moment overblown?
The headlines, well, I guess it depends which headlines you're looking at. I do think Ebola can be contained. We do know how to contain it. It requires isolation of people who are infected while they're receiving treatment. It requires safe and dignified burials so that more people aren't infected at those funerals, because up to 50% of people who catch Ebola catch it at a funeral. I mean, that's what we've seen in the early months of this transmission. So the safe and dignified burial is a really important piece. Of course, isolating people so that more people don't get infected from the people who are already sick. And it really can be contained. But key to that is stepping up the international effort. And we still need more help. We are not there yet.
Can the pharmaceutical companies help more? I mean, there's a drug that's been proffered to help. There's been a bit of confusion over whether it works or not. Then we hear it's out of stock anyway. What is that drug, by the way? And is there anything else like that that's coming on stream to help?
I believe you're talking about ZMapp. It's a drug that has not had human trials to determine whether or not it really can work. And as you've already said, there's not enough of the drug to really have an impact and treat the people who are ill at this time.
OK, not a great outlook, but thank you ever so much for being with us and giving us your educated thoughts there. Winifred Romer, World Health Organization Communications Officer. Thanks for being with us.